Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then Lugol's iodine. In the Lugol's iodine is also called as thyroid constipating agent. In this Lugol's iodine is the fastest acting anti-thyroid drug is called as Lugol's iodine. Mechanism of action of Lugol's iodine. Lugol's iodine will actually inhibit the release of thyroid hormones. It will inhibit the release of thyroid hormones. It will shrink the gland by decreasing the vascularity. It will shrink the gland by decreasing the vascularity. It is also responsible for rebound hyperthyroidism in the patient. It can cause rebound hyperthyroidism also. So this rebound hyperthyroidism is actually a side effect, but mainly this Lugol's iodine will inhibit the release of thyroid hormones and thus shrinks the gland by decreasing the vascularity. So what are the side effects of this Lugol's iodine? This Lugol's iodine can result in iodism, especially on chronic use the patient develops iodism. It can result in salivation in the patient or lacrimation in the patient, or it can cause rhinorrhea in the patient. It can result in angioedema and allergy, or petechiae are also developed in the patient due to Lugol's iodine. Uses of Lugol's iodine is it is mainly used before the surgery to make the gland firm. To make the gland firm, it is used before the surgery.
thank you and thank you for watching.